So joining me today is to my bottom right, Heather Hill. She is a licensed clinical social worker and a trained ecotherapist. She's a former environmental educator, and she is, of course, a nature lover. She helps people expand and deepen their sense of self through engagement in a reciprocal relationship with nature. So we're very excited to have you here, Heather. Welcome.
Thank you.
We also have, along with Heather, Nate Schlingman is a licensed professional counselor with an MA in transpersonal counseling psychology from Naropa University. Among other therapeutic certifications, Nate is a certified nature-informed therapist. So welcome, Nate. Excited to have you here today.
Hi.
Also joining, we have a couple of patients with us today. So we have Michael Ring, a longtime volunteer, and he is a GBS patient. Michael recently told us how much horticulture therapy has helped his body and his mind during his rehabilitation stay at Rusk Rehab. And so we asked him if he would join today and share a little bit about his experience there at Rusk.
Hello.
Welcome, Michael. We also have, to my left, Andrea Waxler. Andrea is an MMN patient. She's a member of our community. And she also shared with us recently during an MMN monthly coffee chat how much equine therapy, so therapy with horses, has helped during her recovery. And she is going to be sharing her story with equine therapy today. And welcome, Andrea.
Thank you.
So without further ado, we can get started. I'm going to kick the conversation over to Amy Stein, a very good friend of the foundation. Amy's a licensed clinical social worker, and she's going to get us started on the conversation with Andrea about equine therapy. So Amy, take it away.
Great. Thanks so much, Maureen.
Yeah.
Good afternoon, good morning to everybody over on the West Coast. Thanks to everyone for joining us. As Maureen said, my name is Amy. I'm a licensed clinical social worker affiliated with the foundation, and I am equally excited about this topic today. I feel strongly that everyone, really regardless of their physical or their emotional condition, can participate in some way in at least one of these therapies that we're going to talk about today. And what we are presenting to you are meant to be complementary treatments to your regular medical care. There are activities that can be done to enhance and support you as you journey through your diagnosis. And so to kick things off, I'd like to introduce Andrea Wexler, who's going to tell us about her experience as an accomplished equestrian and an MMN patient. Andrea, thanks so much for joining us today. And I know you have a little bit of a presentation to give, so take it away.
Thanks. Hold on a second, guys. So I'm Andrea Waxler, as everyone said. I have MMN. I've been diagnosed for about a year and a half and under IVIG treatment. What's a little bit different about MMN than CIDP is that our disease is progressive and there is no remission, and IVIG hopefully helps stop with the progression. So I'll start off by explaining what exactly is therapeutic riding. It is not just a physical thing, it's also cognitive and especially emotional support. So for anybody, you don't have to be an experienced equestrian. If you've never ridden before, never sat on a horse or afraid of a horse, there are still ways that you can participate in therapeutic riding. So individuals of all ages do this, and the reason that therapeutic riding was started as both a discipline and is now something where facilities and people who are your instructors are all certified is because the riding movement of the horse, a horse doesn't just go up and down, it also kind of rotates. And for people, especially for paraplegics, that movement of the horse's body mimics the walking movement, the pelvic movement of human beings. So it really does help you and helps me tremendously with things like balance and cognition. So there are also individuals with emotional challenges, as I would say almost all of us who have these diseases have emotional challenges. Can also help you, just in terms of doing something totally different. You're in a different space. You're allowing yourself just to concentrate on, how you are at that moment. So there are a lot of benefits to therapeutic riding. As I said, it's important to look for a certified facility, and I do have at the bottom of my slide, which perhaps can be posted somewhere. The facilities are credentialed, and there are many all across the nation and internationally. I would like you to pay attention for a little bit to the picture I posted. If you're not an experienced rider and you can get up on the horse using, most places have a ramp or a lift, you will not be up there alone. There's usually 4 people with you, somebody who leads and 2 people, one on each side, who actually have their arm on your leg, and your instructor. So if you've never ridden a horse before, these horses are bomb-proof, what's called bomb-proof. And remember, little children are riding these horses. So if you have no experience, but you would think you would like to participate, I just wanted to show you that you're not on the horse alone riding around. I'm an experienced rider, so for me, it's different. I don't need people holding on to me or leading. So that picture on the left is me and my horse. And that was me before MMN. Once they figured out what I had, or about a year or 2 before, I had to stop riding to the level that I was riding. So that was very disappointing to me. But what I want to explain is that for people with MMN and what I call its cousins, there are other similar diseases, it really helps you improve your flexibility. When you're not on a horse, or you kind of like have a stiff position, you sit in a certain way, you stand in a certain way, you walk in a certain way. When you're on the horse, that how you're using your body has changed. So it helps you with your flexibility, with your balance and your muscle strength. And while you're doing all of that, it's interesting, it's uplifting, it's fun. So I do it. Why do I do it? Because I don't have to worry about falling. I have a foot drop and my leg muscles are weak. I can't run or jump on the ground. I can do it in the pool, but I don't have to worry about falling because the horse is supporting me. And it's more fun than chair exercises for me. It works very well for developing hand and arm strength, using collateral muscles that where your others may not be working well. Good for leg strength. Really important for the brain muscle connection, which is a problem for many of us because you're having to kind of direct your muscles in a different way. And it's just a very joyous and fun activity, and a lot different than regular PT. My daughter broke her arm once, and she said, "Oh, it's not it's a physical terrorist, not a physical therapist." So this has a different feel to it. I wanted to show you this picture. That's me. And as I said, I have left hand and arm weakness and a right foot drop, right leg and hip weakness. So I am unbalanced. And you can see here, I am trying to keep my arms and hands level where my left hand would usually drift down. So this is an exercise that I'm doing. You can see I have somebody hand walking the horse, and my instructor is helping me in terms of how do I concentrate enough to make my arms even. And evenness and coordination are important for us. So now I'm going to show you a little video of me actually in class. And you'll see me posting up and down, and the therapeutic for my muscle strength and everything else, how this helps me. So this is me sitting on my horse. Again, I'm an experienced rider, so this was home for me, which was the best thing when I first walked up the ramp and sat on the horse. They said, "How do you feel?" And I took a deep breath and I said, "I feel like I'm home." So even just that, because participating in something your whole life that you can no longer do, now I'm back doing it, which is great for me. You can see in my right leg is kind of not where it should be, but again, the right leg is the one that's problematic. And let's get this.
Andrea, I don't think we
Yeah.
can see the video yet.
Oh,
Yeah,
Yeah.
sorry.
it says I'm sharing.
Hmm.
Wondering if,
Here's my screen. You don't see it?
I think you might have to click on the link that says YouTube.
Yeah.
I'm not on YouTube. I'm using the player, QuickTime player. Let me see.
Um,
I did also put it on YouTube. Hold on.
Yeah, so unless you can quickly get to YouTube, we can certainly share the video at a later time. We can send it out to
Okay.
the audience.
Okay, sure. Let me just see if I have it up here. I did. Oh, here.
That's all right.
It's right here. Hold on.
There you go.
See that? I'm
Technology.
you can do
yeah,
it.
technology proficient. They say old people are not, but
No,
no.
you're doing a fantastic job.
Yeah, yeah. It's the videos in PowerPoints are tough.
They
How
are.
about that? Can you see it?
Mhm. Not yet.
No.
Well, that's YouTube.
Yeah.
Yeah.
I'm
Okay.
sorry, guys.
Yeah.
No,
No
no worries.
worries. No
No
worries.
worries. You were
You're
describing it well.
Yeah.
I had
exactly.
both ways of doing it.
That's all right.
All right, so let's go back to, can you see here?
We don't see the video.
I'm back to my
We can
slides.
see your
Yeah.
PowerPoint.
Yep, you're still at your
Okay.
PowerPoint.
All
Yep.
right, good. So if you can imagine, I'll just, how about this?
You describe it.
There you
There
go.
you go.
Okay, so when I am posting on a horse, right? I have my hands have to grip the reins equally so that I don't make the horse crooked, right, guys? You see me?
Yeah.
Hands? And I have to hold up my hands so my left arm is weak so that I can drift, so I have to concentrate on that. And I'm posting up and down, core, back, quads, it's a full body workout while you're sitting on the horse. So it's just something where you have a whole body of ability to help yourself. Sorry, that was the best I could do without
That's
video.
great.
That was great, Andrea.
Great explanation.
Yep.
And then I have these frequently asked questions. How did I get started? A neighbor's son, when I first moved in, they were telling me about it, and it was only 10 minutes from my house. And I thought, wow. And I went to get an assessment because you can't just start. They assess you like a regular PT would. And they felt that they could help me. If a patient physically can't get on the horse, all therapeutic riding places have a variety of methods, either a ramp, they put the horse, set the horse up where the ramp is, and you walk up the ramp and you just plop on the saddle. Or they have hydraulic lifts, which can, if you're really debilitated and can't walk up there, they get you on somehow. Should you talk to your doctor? Yes, because all certified facilities require a doctor's note. You can't participate unless the doctor clears you. How has therapeutic riding benefited me? Oh, my emotional state, it just, so much joy from it for me. But really it has benefited me mostly my balance and my muscle strength and my coordination. Those are things that really, I feel like even though there's not an improvement that much in my foot drop, I feel like altogether I'm walking better. I am a little more able to open my pill bottles or, whatever. And how do you find a therapeutic riding program? I gave you the link. This is the touchy part. Is there a cost? Yes, there is. I would say most insurance companies do not pay for it, but most facilities have grants and help with the cost. They all do fundraising. So you can inquire about whether they have a grant or some kind of funding to help override the cost of the lessons. So that was my presentation. I hope
Wow.
that was
That's
helpful.
wonderful.
That was amazing, Andrea. Thank you so much. And I think we just posted put the link to the YouTube of you riding in the chat if anyone wants to, take a look at that. If you don't mind sticking around, we can hold you here for some questions at the end. We'd
Yeah.
love you if you can do that for us.
Sure, I'm happy
Thanks
to.
Thank you so much. And now we'd like to turn things over to Michael Ring. Michael has been affiliated with the foundation for several years. He's a regular at many of our events, and he's an amazing support to our patients in the New York City area. He's going to describe his experience with horticultural therapy as part of his rehabilitation program at Rusk Rehab in New York. Michael, would you start by telling us a little bit about your GBS journey and then how it brought you to horticultural therapy?
Oh, sure. My GBS journey was, the standard crazy trip, severe, fast weakness. In a couple of days, I went from fine to my arms and legs don't work at all. I was always able to breathe. And I spent a week or so in the hospital, and then I moved into acute rehab at Rusk, right in Manhattan. And there I got treated to horticulture therapy. So I can tell you what it was like. Just want to remind everyone, I'm not certified or have any special skills, but it was a good experience. And I was kind of puzzled as to why I would want to be involved in horticulture therapy. And I was given a number of reasons. And the best one was that I was able to do something normal, because when you're in the hospital, you're doing a lot of nothing, and you're waiting around. People might come and talk to you. But, I said, why would I want to repot a plant? And they said, well, it's something you and your family can do together. And it was kind of fun. And it was, when you're in the hospital, everything is sterile. And I got to put my hands in dirt. I mean, they even told me it was sterilized dirt, but I got to muck around and my hands hardly worked. And I don't think I have it anymore, but I took a plant home and I got to remember that my journey, and that it grew when I got home, and because it's all 10 years ago. And sometimes there's a park across the street from the hospital. We'd go out in the park and, move plants around and pick out a pot and put 3 plants into one pot. And it was something to do with the family, with your visitors, that wasn't medical. It was just something nice to do. And then I went back to volunteer there, and I wanted to volunteer at Rusk, and my horticulture therapy people remembered me. So they kind of got me to be in their program. And I said, there's no one who really knows or even cares less about plants than me. Why do you want me to be a volunteer in horticulture therapy? And they said that I'd be fine because they remembered me. And I would go in once or twice a week. And I remember one of my old nurses told me, oh, I'm glad you're here. Go into room 510 and see if that guy wants to repot a plant. And I went in there with the wagon, and this guy said, why would I want to repot a plant? And I said, well, for the next hour, you don't have to be the subject of the conversation. We're just going to do something, and we can talk about baseball. And he was really excited to do that. It was a little bit of a diversion. And, I don't even know if we actually got to the horticulture part. I just went in the room and we chatted, which was pretty rewarding for me. And I went back, for a few weeks he was there, and I always made sure I saw him. But one of the things we did when I was part of the volunteer program is we would get a call from the physical therapists, and they would ask us to go and bring a plant to a certain patient. and we'd have them repotted or move it around while they were standing. And they would stand for a longer period of time than they ever thought they could, since they were injured or got sick,
Amazing.
because it was a diversion from their own illness and suffering.
Yeah.
And also you get to play with dirt. And when you're in the hospital and everything is covered in plastic and everything is clean and bland, putting your fingers in dirt or soil, or it was a pleasant diversion from the bleakness of being hospitalized. And I'll stick around if anyone has any questions.
Yeah.
Thanks, Michael. Can I ask you a couple quick ones now?
Sure.
Mhm.
Did you find it helped you at all with your hands and actually, doing stuff with your hands movement?
A little bit. I don't think it had long-term help, but it pushed me in directions that I didn't think I can get to.
There you go.
Like when I went back to volunteer, the guy stood for 45 minutes when he only thought he had 15 minutes in him. And my hands were pretty paralyzed. And, you don't have to be that accurate when you move plants around. So I was able to grab the plants and move them around. And it was also, the soil it's nice and soft, as opposed to all the metal and plastic things that you touch in a hospital.
Right.
So it helped my head and my hands.
Can you and talk a little bit more about how it helped your head?
Well, definitely. I mean, I was never into plants at home, but doing something that was not medical stuff in the hospital was a great way to spend an hour or two. Just doing something normal, even though it wasn't super normal to my life, it was a normal thing for people to do. Like, let's go repot a plant. It's like, we also did a lot of arts and crafts. I don't draw and stuff in my life, but just doing that physical activity was a much better way to get through an hour than watching TV.
Right.
And also we had a common room. I'd meet the other patients and we'd do it together. We had a little club.
For socialization. Yeah.
Yeah.
Excellent.
So I have a question too for Michael. Did you get to keep the plants?
Yes. It went home. I don't have it. I don't have any idea where it is, but we definitely get to keep the plants.
Okay.
And when I went back to volunteer, I realized why the nurses station didn't just have flowers. A lot of people gave the plants to the nurses, and
Aw.
so the Rusk has a greenhouse up on the 13th floor.
Wow.
There's a terrace and a greenhouse, and the terrace looks downtown from 18th Street in Manhattan. So there was an awesome view, and it was full of plants that had been repotted and moved around. And
That's wonderful. Do most rehabs have this? Do you know the answer to that? We have not heard that before.
the best ones do.
Yeah.
The best ones are going to have
big ones. I can have a greenhouse, I guess.
Yeah, I think if they have a pretty active recreation therapy department.
Yeah.
And if they have the space for it,
Yeah.
We also had bunnies. We had therapy bunnies.
Oh.
These obese rabbits that couldn't even hop off the tray, but
That's lovely.
yeah, they hung out in the greenhouse. But we bring them to patients' rooms, and they definitely would calm down. People were having seizures that stopped. I watched it happen.
Yeah. Wow.
Yeah.
That's amazing. All kinds of complimentary stuff.
Yeah. Well, thanks, Michael. That was really awesome. And I'd love to hear about your experience. Thanks for sharing all that. And I hope that, any patients out there looking for a rehab program, they'll ask if they have a horticultural therapy program. We know really how beneficial it can be.
Yeah.
And so now I'm going to turn things back over to Maureen, who's going to get started with the second half of our program, and we can learn all about ecotherapy.
Awesome. Great. Thanks, Amy. And just a reminder, we are seeing some questions coming in, but if you have questions, just put them in the Q&A box on the bottom of the screen, and we'll try to get to as many as we can at the end of the webinar. So I'm going to kick the conversation over to Heather and Nate, our ecotherapists on the call today. So let's just start with the very basics right now. Heather, I'll start with you. Can you just explain the difference between ecotherapy and regular psychotherapy?
Sure.
Yeah.
I actually have a slide that kind of covers that. So let
Oh,
me
good.
um
You share your screen there.
share my screen. Oh, wait a second. Oh, wait. Okay, can you see that?
Yes. Yep.
Okay, great. So,
Okay.
one of the main differences between traditional therapy and
Mhm.
ecotherapy is that ecotherapy tends to happen outside. It doesn't have
Right.
to. So
Mhm.
that the sort of boundaries, the container, the four walls, has dissolved.
Mhm.
And as well, sort of the hierarchical relationship that is sometimes implied in therapy, where the therapist is sitting there as the sort of professional and the expert, and then there's a client. So it's a more democratic shared space.
Yeah.
You're either sitting down outside in nature or you're walking. Um, so being outside, there's a lot more going on around you. So it's a very present, there's opportunities to have some present moment experiences. And it is a little bit more experiential. It can start out looking like traditional therapy,
Mhm.
just maybe in an outdoor setting. But then inevitably what happens is something shifts, something happens, nature comes into the frame
Yeah.
or into the conversation, and the therapist can then sort of focus on that experience and go
Mhm.
into the present moment. So it's a little bit less predictable.
Yeah.
It's a little bit less confidential, and we
Mm.
do have to talk to clients about that because we cannot guarantee confidentiality when we're
Mhm.
outside in a
Yeah.
in a public space. But we talk a lot about that in the assessment phase and
Yeah.
make sure that the client is comfortable and we have a plan for what to do if somebody else or even a dog or something comes through. And yeah, I think that those are sort
Yeah.
of the major differences.
Yeah. Yeah. So do most people, when they come to you for therapy, are they open to doing therapy in nature or going outdoors? Or is it
It's a
sort of 50-50?
It's a great question. I advertise I am an ecotherapist, so I have
Mhm.
people coming specifically for that
Gotcha.
experience. So I would say it's about 30% of my
Okay.
caseload who want to go
Okay.
outside. I do try, always try to bring nature in, even if we're
Yeah.
inside. I mean, that's one of the things about ecotherapists is that it doesn't have to happen outside either.
Right.
We can bring plants in, we can bring shells, anything. We can bring things into our space
Hmm.
and talk about nature in that
Yeah.
regard.
Yeah.
But it's not always true that someone comes for psychotherapy and wants to then continue
Yeah.
in an ecotherapy situation.
Yeah. Great. So Nate, I'll kick it over to you. I see all the plants around you there. So what is your thought on indoor nature therapy? Do you recommend people getting plants, or if somebody is not mobile or able to actually take a walk or move around outside much, what would your recommendation to them be?
Great question. So we have an answer. Uh,
Mhm.
yeah, so next one. No, here we go. Okay, so the question is like nature therapy indoors.
Yeah.
And so this slide gives like some different possibilities. The
Mm.
first one is kind of the most common, but any one of them work great. So oftentimes, I'll just work with a client and have them find a place that's comfortable for them. And it can be oftentimes outside. Like
Mm.
that's a good goal. Um, but if that doesn't work, the second one here, indoor or sensory garden, um, if the client can just, have some plants that they connect with or some stones or whatever. And so I also work a lot in Gestalt therapy, and this
Mhm.
can help with just metaphor and ways of talking about things that are difficult and kind of abstract, especially when we're talking about health, where it's an internal health medicine problem that from the outside, it's hard to explain, but to use analogies and things. But really the answer is, yeah, there's always a way to incorporate nature therapy, indoors or outdoors. Yeah.
Yes, and I love that you have sounds up there too. You kind of are hitting all of the senses there. So when you do virtual sessions with people, are you playing nature sounds? Are you how does a nature session work virtually?
That's a great question. And it's like any psychotherapy session, everyone is very unique. And so it's really different. If I'm working with somebody and they're able to go outside and connect, we'll do maybe a little mindfulness activity to just connect with the senses, see what's around them, see what they're hearing, smelling, seeing, and then try to maybe bring those things into the session. And that's helpful in a way of just connecting us a little more physically. We don't have that feeling you get. It's different, right?
Yeah,
This is a different experience than if we were all sitting in like an auditorium together or something.
right.
But I love the way like the equine therapy was described and the movements, and I was like getting that kind of physical connection earlier this session, or like, if I start like talking about this plant and like how it feels, and like it just kind of connects us in a different way.
Yeah.
And I feel like it also pulls us out of the mind trap of being online and other
Yeah.
things we could be doing
Yeah,
while the computer's
absolutely.
in front of us. Yeah.
So I'm going to take you guys back a step. So Heather, I'm going to turn to you first. How did you get involved in ecotherapy? Is there a story to your path there?
Well, yeah. So the story is just I always have loved nature, always felt a lot calmer when I was outside.
Yeah.
And when I had my children, I took time off from my clinical work and I went to work as an environmental educator in the midst of Philadelphia in the Wissahickon. And I just loved it. And I saw kids who came in who were incredibly fearful of nature because they really hadn't been exposed. And I saw them sort of relax that fear. I saw them get really excited and have a sort of new sense of vitality. And I kind of felt like when I went back to clinical work, why can't this has to work for adults as well. So
Yeah.
I was trying to find a way to bridge the two. And I just Googled ecotherapy and took a training
Wow.
course, which was out west, and now it's migrated east. It's really becoming a much more sought after, popular, sort of a little bit more mainstream, not a lot, but a little bit
Yeah.
more mainstream. People are understanding it more. So got some training and continue to get training, which is important. I mean, I heard Andrea say too, certification is so important. There is no certifying body for ecotherapists at this point. So it's all the more important if you're getting ecotherapy. And I define that like, ecotherapy is an umbrella term. It incorporates equine assisted therapy, horticultural therapy, anything that really connects people with nature.
Yeah.
So we use that term a lot. Nate and I are using it in the way of doing psychotherapy in nature. So we're mental health professionals, and we're taking our practice to a different, we're expanding it to the outdoors. So we do use the term a little sloppily, and we kind of use it for a lot of different things. But there is no certifying body for what Nate and I are doing. Although we both do have the certified nature informed therapy credential because we took a big training together down in Maryland. But anyway, my point is anyway, that's how I ended up as an ecotherapist.
Yeah, it's experiential. I mean, you can get the certifications and we can use as many words as we want, but until you experience nature, really the wellness that you feel out in nature, any kind of nature, whether it's working with animals or plants, then you really kind of get what we're talking about here, right? It's not about a specific title, it seems like, or a specific topic. So Nate, how about yourself? What drew you into this world of nature therapy?
Yeah, I mean, kind of similar to Heather in a way of just really connecting with nature myself. I can relate a lot to the conversations around health. I had a spinal cord injury when I was 21.
Mm.
And before that, I was on the crew team and rode my bike across Europe. And then all of a sudden I, was kind of working my way out of a wheelchair.
Mm.
My right leg's still paralyzed, my left leg isn't. But just being able to get into nature was incredibly healing for me, because, I felt like a lot of the world was cut off, but I was able to, I remember one afternoon just kind of use my Lofstring crutches and get myself up into the woods behind my house and just sit
Mm.
and just feel okay. And yeah, so I did my work, became a therapist, and just really wanted to be able to bring myself into the field of ecotherapy, and met a colleague of ours, Lauren Kahn, who was doing the work, and just kind of meeting her inspired me to just start taking clients outside. And that's the thing. It was kind of a renegade thing for me. Like, I didn't have any training. I just was like, well, nature's healing. I'm a healer now. I'm going to do this in a healing place.
That makes sense.
But over time, have done a lot of research and training, and gotten a lot more understanding of the field.
Yeah, that's amazing. So tell me, you brought up research. Is there any, and to me, it's sort of like, well, if you take a walk outside, you feel better. Do we really need to have research? But it is very interesting when you find the research that backs up how the health benefits of actually just being around nature, right? So do you guys have, well, it looks like you do. You have some research to share with us, and some places where people can find research about that as well.
Yeah. So push myself forward there. Oops. There we go. Sorry, go ahead, Heather.
Oh, sorry, I have a siren going on behind me. Yeah, there is a lot of research. Since 2010, there's been actually an explosion of research that supports ecotherapy. So a lot of what you'll find now is literature reviews, and like this is a 2018 study of meta-analysis of studies that showed some real decreases in heart rate, blood pressure, cholesterol, from increased green space exposure, and decrease in cortisol, and the stress hormone. Frontiers in Public Health is a very popular one that has a lot of research. Frontiers in Public Health, the Journal of Eco-Psychology, and lately depression. There's a recent study, I don't know if it's on here, that looks at the depression. Sort of the gold standard's always been cognitive behavioral therapy to treat depression. And so this recent study, I'm not sure exactly if I have it on here or not, compares ecotherapy to cognitive behavioral therapy and looks at how it impacts depression, and they were found to be equal. So that's really good. I think it was a 2023 study, actually. So that's really good sort of evidence that supports the work we do, because the work we do, whether we're cognitive behavioral therapists or any other kind of psychotherapist, we can still do it outside, but the gold standard has always been CBT. There's a research study on here that also talked about dosage, right? Like, how much nature do you need in order to get some of the benefits? And I think a lot of the studies show like 20 minutes a day is sort of like the sweet
Easy
spot.
enough.
But even 5 minutes, even stepping out of the doors for 5 minutes can make changes in the sort of autonomic nervous system. So yeah, that's some of the research studies. We can put in the chat or something. I can transfer them if you need. But Nate also, I think, has some that he wanted to discuss too.
All I would add in, I'm teaching at Drexel University now, and just finished a class with the creative arts therapy program, and I would say like a quarter of the students did their research on ecotherapy, like connecting art therapy and music therapy and dance therapy to ecotherapy. And I recently interacted with a PhD student at Penn, and she said that's all people are researching right now. It's kind of like mindfulness. In the 80s, it wasn't really a thing in psychology, and now there's limitless studies that show its value. And I think the same thing's happening with ecotherapy at the moment.
Yeah, that's amazing. So you brought up mindfulness. So is there any research regarding like meditation in nature? Is it more effective if you were doing mindful practices in nature versus you know, inside?
Yeah. So, oh, that was another research part. So this is a little slide on mindfulness in nature.
Yeah.
So my statement is that nature practices mindfulness on us,
Mm,
right? Because if you think about a definition of mindfulness I use is, working on developing your attention, awareness, and I throw in acceptance. And when you go into nature, it draws your attention. You
mhm.
become much more aware of the present moment, right? It kind of pulls you out of your head. And so I think that really, really helps clients in the session feel kind of held
Yeah.
in that present state
Mhm.
and able to work with things that are hard to talk about, which is mostly what we try to do in therapy, right?
Yeah.
And able to do that with kind of this support. Now, if it's pouring rain or icing out, that might be different.
Yeah.
But on average, and I think this is another question, I do it year round. Yeah, it just seems like a really comfortable place that people feel held in that kind of mindful state. And then these are some different ways that kind of teach clients to use nature therapy on their own
Mm,
when we're not there. The nature walk, forest bathing, sky gazing, having a sit spot that you can go to regularly.
yeah, that's wonderful. That's
Those
a
are
great
just some.
slide.
There's actually like
That's a great slide to share with everyone afterwards too. So forest bathing, I have a word that I'm going to bring up, and I'm wondering if you guys have heard of it before. So it's called earthing. You ever heard of earthing? It's, they say that walking barefoot on the earth is supposed to be healthy for you, anti-inflammatory
yes.
and so forth. So just curious about that. Is this something that you talk about, that you work into your practice? For people to kind of get hands or feet on the earth.
I do. I mean, yes, I have. I don't know the science behind it,
Mm,
but even just as a mindfulness activity, I
yeah,
love to invite my clients to walk barefoot on the
yeah,
earth.
yeah,
I just find it's really grounding and
and
connecting and
grounding.
calming. Yes.
Yeah,
But I know that there's some anti-inflammatory benefits to it. That's
Yeah.
what I've heard as well. But I don't know the science behind it.
yeah. Nate, anything to add to that?
Yeah.
Same.
For me, it's different. I typically when I'm outside, uh, just with my health situation, I'm using kind of gear. Part of the gear is
Yeah,
shoes,
yeah, yeah,
just because I wear a leg brace and stuff. And
gotcha.
so I rarely get that chance. So it's
Yeah,
definitely not part of my practice, but I
right.
do know when I get the chance to like take everything off, it feels so good
Yeah,
to just
yeah. That's amazing. Okay, well, we do have some questions that have come in from the audience, so we can maybe take the screen share off at this point and turn over to some Q&A. See what we have here. Study positive lasting effects being in nature in the area of tree bathing. Someone just mentioning there is research, Japanese researchers have studied the positive and lasting effects of being in nature in the area of tree bathing. So I think, right, forest bathing, tree bathing would all sort of be the same thing. A question, where can I find an ecotherapist?
It's a good
Yeah,
question.
yeah.
So Google
Yeah.
ecotherapist. That would be the first thing. I know it's very obvious. There is not, as of yet, I don't think, like a sort of directory of ecotherapists.
Mhm.
But if a person has a therapist, I would also encourage them to ask their therapist about it,
Yeah.
because I think Nate and I are involved in an organization called Philadelphia Ecotherapy, and it's a
Mm.
training organization for therapists. So I think the more therapists become aware of it, they're going to hopefully get trained. It's
Right.
not, you know, a long training, it's a couple day training. Anyway, so I would encourage, if you already have a therapist, to sort of ask that therapist, and then just to Google ecotherapy. I don't know where this person is coming from in the world.
Yeah, you may even just ask your therapist, hey, can we do this session outside?
Mhm.
Who knows? Maybe you're gonna start that conversation. Okay, another question is ecotherapy a separate session, or does it integrate with neurophysical therapy or OT? So any connection with physical therapy and occupational therapy, or maybe you see some of them at the ecotherapy training, some physical therapists, that might be something they incorporate into their practice as well? Any connection there that you know of? No?
We have had other types of therapists come,
Mhm.
but not to our trainings, but I would imagine that in those fields, there are people trying to bridge that gap,
Right.
but that's kind of like a separate
Yeah.
field. So,
Yeah.
and I haven't crossed that.
Right. Right. Okay. Is
Can I
there,
ask a couple questions too?
yeah.
So how is ecotherapy reimbursed the same way that traditional therapy is by insurance?
Mhm.
Yes, no, well, it's a depends question.
Yeah.
We've been working on that a lot. So it depends on the insurance.
Mhm.
It really depends on the insurance and the therapist, and exactly where you are meeting. So
Hmm.
it is an open question, I would say, at this point. If you are using your insurance for therapy, that therapist not allowed to sort of charge a different rate for therapy, so that can happen. But we're very much sort of in the trenches of trying to help insurance, like trying to move that along, right?
Mhm.
Yeah.
And just like now, a lot of insurance companies pay for acupuncture, like things like that.
Right.
Like we would
Yeah.
like this to be somewhat about, I mean, the research is there. We would
Yeah.
like for it to be reimbursed by all insurance companies.
Yeah.
Absolutely.
Yeah.
Can you, thinking about some of our patients that might be bedbound, and what sets kind of maybe set a picture maybe of how a patient could situate the room, maybe bring the outdoors in to kind of help them kind of connect to nature and do their own kind of thing? Describe what that might look like, what they could do.
I mean, yeah, there's a lot of ways I could think of, and I think if I was working with a patient who's a client who's bedbound, that would be a really great conversation and like creative way to manifest that, right?
Mhm.
Because I could make up a lot of things in my head about how they could do it, but maybe I'm thinking their family or friends could help them, by doing something. Like, one thing I have is a nature basket from,
Mhm.
like walking around and collecting objects from being around. And like, I like to keep that in my therapy office. And maybe someone could do that for them, but maybe they can't. Maybe they're kind of, they don't have a lot of connections like that. And maybe that's something we would work on. It's like, okay, how can we build a connection with somebody to help you get that? Because that's a really important skill for anybody. And so I feel like it would just be really, again, it's so unique for every client, but there's so many ways that you can do it. Having plants in the room,
Mhm.
though, then maybe allergies come into effect. So there's, it's just really trying to see what fits for them, what meets them.
Yeah.
But Heather, do you have anything you want to add?
Well, you could tell I'm like, oh, I want to say this. I found this website and in doing research. It's in Massachusetts. It's called the natureconnection.org. It's an organization in Massachusetts somewhere, but I really would love to bring it here and everywhere. And it's sort of like what Michael was talking about, like people bringing nature objects like seaweed, moss, dirt
Mhm.
into more institutionalized sterile settings, like nursing care, and all these places, with that idea itself, to bring nature in, because
Yeah.
when you're in a hospital or an institution,
Yeah.
you don't really have access. There's also studies, though, that a view or a picture of nature can
Hmm.
help, boost
Yeah.
mood and things like that. but just having these objects with the tactile, the smell, all the
Yeah.
different senses, the more senses that are engaged, I think,
Yeah.
the better. So that's a wonderful organization that if anybody wants to take that
Great.
idea and run with it, I'll
Yeah.
be right there.
That's wonderful. Did you have another one, Amy? I have
I
a
think
few more.
I think that's it. I just want to mention one thing, Andrea, to let you know that we had an attendee just thanking you, telling you when did you know that your talk brought tears to her eyes, that she's an equestrian as well, and she has 3 mares who helped her emotionally to keep going during her most challenging times, and just
Yeah.
thanking you for participating today.
You're welcome.
Yeah. So an odd question, but regarding technology, which you don't tend to think of that during a nature conversation, but are there any apps that you can recommend, again, for people who are finding it hard to get to a therapeutic session or get outdoors at all? And also, I think it would be nature sounds comes to my mind of an app that maybe has some good nature sounds too.
Yeah, so I just put up this slide that has some apps. Forest Bathing Life is a lot about like the forest bathing that one of the participants mentioned.
Right.
Tranquility is something similar. Insight Timer Jumping Down also has some guided visualizations.
Yeah. That's great.
There are nature sounds. There was an app that looked amazing for it, but it's not available anymore, called Roots. But I bet you could just find that too online. And here's a couple websites: Healing Forest, which has some ideas for mindfulness activities in nature, and findingnature.org .uk. What's cool about that is it's got some of the exercises that Nate had brought up, like sit spot, and it's got the research that then supports it. So it's a cool
That's
website.
great. Yeah.
I also have seen research now they're doing on virtual reality and being able to use virtual reality
wow.
to kind of have a nature connection. And, I hate to say it, but even TV shows on nature or the bird, like I put up the bird thing for my cat, like sometimes like there's
Yeah.
a lot of TV, that can be calming,
Yeah.
different kind of
That's
reality.
amazing.
Yeah.
It is a different kind of reality. So can this PowerPoint be available to us that we can give it out to people who are on the call today? Would that be okay? Or at the very least, just some of the websites that you've referred
Sure.
to? Okay,
Absolutely.
that would be wonderful.
We can share the whole PowerPoint. It's
Oh,
great.
that would be great.
Thank you.
And Andrea, I actually had a question for you. So you and I chatted before the webinar about if somebody is not interested necessarily in being on the horse, but being around the horse, are there therapeutic benefits to that? And can you speak a little bit to how they can get involved in equine therapy with being on the horse?
Sure. I think
Yeah.
that there are ways that you can connect with a horse, not on the horse. And
Okay.
so a lot of the facilities have what's called a round pen. And the person is in the round pen with the therapist, with the horse. And there are different exercises in terms of making that connection. And so like one of my horses, I got a horse that was a young horse, and you frequently do these kind of ground exercises. I don't know if you've ever seen, but you direct the horse with nothing.
Yeah.
And there's this thing where when the horse is relaxed enough, they start to chew, they lower their head, and they come to you because you're giving them something that they get attracted to you, and then you can walk around and the horse is just following you, or the horse's head is right here. So there's this how do I connect, and mostly non-verbally, using my body to cue the horse, because horses obviously they don't have language. They communicate like a horse's ears. If they're pointed forward, they're curious.
Yeah.
If they're flat back, they're angry, like stay away. If they're flapped a little bit sideways, they're paying attention to you. So you pay attention to the horse's cues and see how that changes.
Mm.
There are also therapeutic programs where grooming,
Mm.
obviously, and that's one of the first things that I struggled with, by the way, which was like, what is this? Where you curry the horse's coat with a curry comb. So that takes a little bit of physical movement with your hands. You brush the horse's tail. For those of us, maybe this is genderism, I don't know, but for a lot of little people, when they were little girls, they had a My Pony and they
Mm.
like to brush the tail. And
Mhm.
it's kind of that same tactile kind of activity where it really lowers your blood pressure and gives you a different space.
Yeah.
So there are many different non-mounted things where that connection to the horse can be very beneficial and even physically beneficial for people who either don't want to or for whatever reason physically can't get on the horse. Yeah.
That's terrific. It almost feels like you could watch horses walking or running in a field, and that could be a mindful activity too,
Right.
right? Just
Yeah.
being around them.
Right. Just being around them.
Yeah.
I think that they do that for people, I don't know, for some kind of anxiety where they actually
do.
put people in a field
Yeah.
with lots of horses,
Mm-hmm.
which, you're this big, the horses are this big, and to overcome the anxiety of that. And you can visually see when the person calms themselves, the horses approach.
Yeah.
When you're in an agitated state, the horses,
Interesting. So they're reflecting your state of
they
mind.
absolutely reflect. I'll give
Very
you an example
interesting.
of that. I was showing my horse, and when I do dressage, which is something
Mm-hmm.
people may not have heard of, but you have to come down the center line, halt, and salute the judge.
Mm.
And it was 105 degrees. I'd had it, I didn't warm my horse up much. I came down the center line, halted at X, saluted the judge, and I went, and in the split second later, my horse went,
Oh,
but that they feel it.
wow.
They feel,
Yeah.
think about a horse in a herd.
Yeah.
They feed off each other's
Yeah.
emotional state, I guess.
Yeah. Yeah.
They're prey animals, so they're
Right.
very sensitive to, oop, that one's alert, I have to be alert.
That's interesting.
So, yeah, there's a lot that you can do, just being around.
Yeah. I guess, and you could sense their calmness, and that could make you calm as well. It could work
Right.
vice versa. That's very interesting. Great stuff there.
Mhm.
So guys, we are at the top of the hour, but does anyone have a final thought or anything that they wanted to share that we didn't get to in our discussion? We had a wonderful discussion, and I want to go take a walk right now for sure. Right? I think we're all going to go do something out in nature. But thank you so very much. And as we said, we'll be sharing the webinar PowerPoint with everybody on the call today. You can call the office if you have other questions that come up, and we'll try to field them out to our experts here. And thank you so much for joining. We hope you got a lot out of it. I know I did. And we hope to see you guys next time at the next webinar. All right. Take care.
Thank you.
Thank you.
All right.